And so the next question is, what can the primary care doctor do?
Yeah.
So yes.
How we can screen those people at risk. Can you shed a light on this?
Yes, it's such a good question. And I know here in the kingdom and also in Canada, screening for MASH is unfortunately very uncommon. Almost because, like we've both been saying, it's silent and we don't see it. It's not a symptom.
Yeah.
It's not something that shows up on blood pressure measurements, for example.
Yes.
So screening for this disease, we consider two categories of what are called non-invasive screening methods. Invasive is biopsy, and that's not very popular with patients, and it's very expensive, and it brings much risk.
Absolutely.
So non-invasive falls into two categories. The first category is blood work. So the second is imaging. And so the most popular, easiest, least expensive method of blood work non-invasive screening for MASH is a test called the FIB-4. The FIB-4 test is a logarithmic calculation, very easy to make, that includes the data of a patient's AST, their ALT, their platelets, and their age.
Okay.
Anything above 1 point, so we have a patient we suspect, again, maybe an ultrasound that showed a fatty liver, maybe high triglycerides, maybe impaired glucose tolerance, very common in diabetes. I would suggest screening all patients with diabetes. Doing a FIB-4 test, we arrive at a value. If the value is 1.3 or above, that is suspicious enough to go on to a next non-invasive test. And the next non-invasive test is most commonly available, I have found in the Kingdom of Saudi Arabia, is a test called the FibroScan.
FibroScan,
So
yes,
now
yeah.
imaging. And the FibroScan can score to tell us whether there is a stiffness in the liver, and that would further suggest to us a progression along the process of MASH. Again, we are leaving MASLD, which is just fat within the hepatocyte, and we're talking about a progression to MASH, which is now cell ballooning and inflammation and fibrosis that is developing in the liver. And by these non-invasive tests, we can start to isolate and identify patients that we should treat. Now, one more very important point. You know, I think one of the reasons why screening for MASLD and MASH has not been common in Canada or in the Kingdom is because there was nothing really that we could do about it.
Yeah.
It wasn't, we could tell someone, oh, you should eat less and you should move more and you should diet. But these are not effective treatments for
Absolutely.
obesity or for MASH or MASLD. And so one of the reasons why it's a very exciting time for a primary care doctor in the Kingdom to start to address MASH and MASLD
You have a
is because we
treatment.
have treatment.
We have a
Yeah,
treatment.
we have
yes.
treatment.
Okay. Yeah.
There's something you can do very effective.
Okay.